I will officially call this May 21st Public Safety Subcommittee meeting to order. And I will ask us all to rise for the pledge. And Nancy was prepared and had the flag. So Nancy, could you kick us off this morning?
Oh, I would be so happy to.
Thank you so much.
I pledge allegiance to
the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning to you all. It is wonderful to have my weekly check-in with you all and feel like I'm connected to the world in some small way. So I do not have any public audience or comment that I received. Maria, I presume you do not either?
None.
Okay. Again, the only public comments and otherwise that we get is that the residents and members of this community find this meeting extremely valuable and appreciate all the hard work you guys are doing. And they really do look to this group for their source of information and feel good about what the town's got going on from a response standpoint. So thank you all for your hard work again. We had the meeting minutes that Karen once again diligently prepared for us from May 14th. Those were in the packets. Did anybody have any comments, questions, concerns? None? All right, we'll consider those adopted. And then, as I always forget to do, because it's not on my agenda, we will do quickly.
Uh-oh.
He froze.
Am I back? There we go. Sorry. Melissa, I'll do roll call quickly. Sorry, my technical issues here. Melissa Appleby's family has grown, so she will not be joining us. Everybody is healthy and happy and hopefully at home soon. So we're looking forward to getting pictures and a full report on the little guy. Chief Baldus.
Yes, here.
There he is. Morning, Chief.
Morning.
Michael Berry.
Michael Berry's here.
Michael, Chief Boulter.
Yes, good morning. I'm here.
Hey, good morning, Chief. Maria Capriola, Town Manager.
Morning.
Morning. Kristen Formanak. Kristen, you with us?
I'm here. Good morning.
Hey, good morning. Jennifer Kurtanis.
I'm here.
Good morning, Jennifer. Kevin Kowalski.
I'm here.
Good morning, Kevin. Mark Kritz.
Morning.
Morning.
Hey, Mark. Mike Long. Good morning, sir. I'm back again. Sorry. I don't know if Mike was able to acknowledge he was here. Good morning, Mike. Sorry, sir. It's good to see you. Melissa Marquis. Mark Bissaro. Hey, Mark. Sarah Nielsen.
Yep, I'm here.
Good morning, Sarah. Chris Peterson.
Good morning, present folks.
Morning. Tom Roy, as always.
Good morning.
Nancy Sheets led us in the pledge. Thank you, Nancy. Karen Stewart.
I'm here.
Morning, Karen. Neil Sullivan.
Yep, good morning, everyone.
Good morning. And last but never least, Gary Wilcox's iPad.
Gary Wilcox's iPad is here.
Good morning, Gary. Thank you for being a good sport with that. It's my little dad joke for the week, and it brings me joy. So, all right. Kevin correctly reminded me, and we need to properly honor an extremely long, as he reminded me, a charter member, I believe, we believe, of this public safety subcommittee passed this week. Lucy Bowman, unfortunately, is no longer with us. 57-year member of the Simsbury Volunteer Fire Company's Women's Auxiliary. An amazing contributor, obviously, to this group for many years, as we were reflecting on before we went live. Lucy always found the typos and made sure that we were running on the straight and narrow, and accurately reflecting what this body was charging forward with. So I'd ask for a moment to respect Lucy, please. All right, thank you for honoring that. As we said, Lucy will be sorely missed by not only this group, but the community at large. We will jump right into the agenda from there. Jennifer Kurtanis, the Health District, please.
Yep. Good morning, everyone. As of yesterday, we had 39,000 cases in the state, 3,500 deaths, 106 cases in Simsbury, and 12 deaths. we continue to track all of this and the infectivity rate associated with those that are tested and those that test positive. There is a new push at the state level to do what's called point prevalence surveys at our long-term care facilities. These point prevalence surveys are testing of everyone in the facility and all staff on a given day so that you have a snapshot in time of all of your positives so that it can be used as a strategy to cohort your residents as well as your staff. And I think this is where some of the increase in testing numbers is reflecting is the push that is happening in these long-term care facilities. As you know, yesterday was the first phase of Reopen Connecticut. So we have been just inundated with, over the last week, and even prior to that, questions, concerns regarding how and who can open and under what circumstance, et cetera. So I think, it's going as well as can be expected. We are fielding many, many inquiries, complaints, concerns from the public about what they're observing, what they think needs to happen, what they think needs to happen that's not happening. So I just, again, want to caution the public that, masks, are required for, individuals that visit establishments, but there are some exceptions, like people that have medical conditions or feel they cannot wear masks. Again, maintain the social distancing. Do what you can to protect yourself. If you don't feel comfortable in that type of an environment, you have a choice not to be there. Obviously, we want to receive, complaints if there's real egregious violations of some of the requirements. But again, people need to do what they can to protect themselves as well. We continue to participate in a weekly PPE distribution. In fact, we have to go deal with that as soon as I get off this call. For the past 2 weeks, we have not received any N95s. And today we are receiving some, which has been a real necessary commodity for, home health agencies that might be supporting people that are recovering at home and a variety of other settings. So we're happy that we received some limited amount of N95s this week. The Farmington Valley Health District is piloting the, what has been touted as the state's contact tracing platform. I can tell you that it is not up and running. There are challenges with this electronic system. We are providing as much input as we can to the state about how it's working, how it's not. So slowly, we anticipate that system will improve. In the meantime, we continue to do all of our contact tracing using kind of a paper-based and a homegrown system that we have here. It's very challenging, to say the least. So, those are my updates. We are very stretched. We're stretched exceedingly thin for the work that we're doing. And my goal is to just try and keep my energy and my staff's energy up as we continue to move through, because as we know, this is a marathon and not a sprint. That's it for me.
Jennifer, we appreciate that. And you've been sprinting for this entire marathon, so hopefully you get to run to a steady state pace at some point here. 2 questions for you. We had talked about the testing thresholds. given the long-term care facilities, are we hitting from the state standpoint the testing thresholds that were talked about outside of those numbers to reopen?
You know, I can tell you that our membership organization, the Connecticut Association of Directors of Health, has asked repeatedly for an update from the state, whether that be the health department or the governor's office, on what the testing strategy is, what our goals are, where those testing sites are, and we have yet to receive any kind of update with respect to that. I can tell you, as the local health director, it is very frustrating to me. I cannot point individuals to, I mean, I can point them to the 211 line, but we do not have readily, easily accessible testing for instance, people that have symptoms or people who believe they have been exposed. So I don't know that we are there and where we need to be with the testing. And I do think that the point prevalence survey testing is skewing the perception that we've got far more testing capability and access for the general public.
Yeah, and that's my concern. And that leads to my second question is, not only did I thought that the testing was the linchpin to reopening, but that the contact tracing was as well. So I'm not concerned with you, but concerned that the state system isn't ready and up and running for that, yet we're reopening.
I mean, it is, yeah, the contact tracing is not where it needs to be in terms of a statewide system. There is no doubt about it. And not only that, we still have the data that goes into that contact tracing system still comes from our Connecticut electronic disease surveillance system, and we know that there are delays of getting the results from the time the specimen is collected to being analyzed to getting into that system. There's been some improvements, but at one point in time when we looked at our data, it was anywhere from a 4-day to an 11-day delay from the time a sample was collected to the time it showed up in our system.
Yeah.
And so if we're really looking at, you know, this as a way to quickly identify cases, isolate and quarantine contacts, we've got a little ways to go.
Yeah. And my intent here is not to be critical, because I know locally, statewide, federally, everybody is trying to figure this out as we go. But my concern is more informative in that what we saw change with nail salons and hair salons, et cetera, I would expect there to continue to be evolution in what actually opens and timelines. And that may lead to frustration with residents, but everybody's figuring this out as they go, and there's going to have to be pivots and changes in the plan, as at least as I see it. Is that fair, Jennifer?
No, I think that's very fair, and I mean, I thank you for pointing that out. You know, and I want to emphasize with individuals, again, as we, you know, as public health professionals, we have to draw a line in the sand and establish guidelines and criteria and protocols for the greatest good. At the same time, individuals can do what they need to do to protect themselves. And we've built in layers of protection, you know, from hand hygiene, stay home when you're sick, social distancing, wearing masks. And so those are the things individuals can work to strive to do, while at the same time we establish plans and protocols that we hope will protect the masses, the populations that we serve.
All right. Appreciate your work there, Jennifer. Folks, open it up. Any other questions from anyone else in the group? My friend, go get some rest before the delivery.
Well, actually,
Sorry, Kevin, go ahead.
Thanks, guys.
Yeah, sorry, Jennifer. I don't know if you're going to be leaving the call. I was going to review our discussions briefly under the emergency management end of it, but we have an opportunity for testing that we're investigating for our first responders and town employees and business community in general, standing up a test site. We're trying to understand the particulars of it, see if it's of value to the community, and Jennifer's been helping us with that. And it'll take about 2 weeks to stand up if in fact we go with it in the future. So we are looking at standing as apparently one of the leg of the stool that we need to open up the town and state. So we're going to try to do that. We just need to do it correctly. So
yeah, Kevin, I want to thank you, for spearheading that and beginning the conversation with the vendor that's interested in doing it. There are some benefits to it. I just want to chat offline with you and Maria about its alignment with, CDC and state guidelines and clarification on how it would be used for the clearance for work, because there's some inconsistencies there. But I think, we can get through all of that.
Okay, good. Like I said, if we can talk offline, perhaps later on this morning, we can maybe have a conference call with the company.
Yeah, I'm not able to do it this morning, but I'll shoot you some times that I'm available later.
Okay, thank you.
Yep, thank you.
Guys. All right. We'll move right into Town Manager. Maria, I believe you got a robust update for us.
Great. Good morning. Thanks, everyone. Good to see you all. Beginning with our open facilities. So again, our transfer station is now open. We are providing full services there, but we do have modified practices. Our town and Board of Ed tennis courts have also reopened. We're allowing members of the same household to do recreational play there at this time. And our town parks, our open space parcels, and our trails do remain open as well for activities such as hiking and cycling and walking. We have begun our soft reopening planning for that of our municipal services programs and our buildings for the summer. Some of the primary areas of focus that we've been working on is how we're going to gradually phase back in our administrative staff in our buildings. Initially, we were looking to do that on or around June 1st, but again, as more information has become available, we are likely pushing that date out to about June 20th. And at that point, our staff would sort of go to a rotating A and B schedule. And again, that's our administrative staff. Our sewer, highway, and facilities crews will be back to full strength following Memorial Day, and I'll let Tom speak to that during his portion of the meeting. Our parks and golf crews are currently at full strength. And regarding the police department, I'll let the chief speak to that later in the meeting as well. Our library staff is doing right now a soft rollout of a curbside delivery program for materials. These are for materials that were placed on hold prior to the pandemic, but we are working on a full curbside pickup system for people who would like to begin receiving library materials again. And we're hoping to have a full rollout of that program on June 1st. We have been planning the Parks and Recreation Department for a potential summer pool season as well as a potential summer camp season. If things are safe and we are able to open those programs, a tentative dates for summer camp would be June 22nd and for our pool season, June 20th. For our senior center, right now we are unfortunately looking at a much later opening date. I would say at least Labor Day at this point. It could be later in the fall, and worst case scenario, it could be the end of the calendar year. Our public buildings will remain closed to the public through at least July 5th at this time. So we are not allowing walk-ins into our buildings, but we are at the discretion of staff taking appointments for matters that can be conducted virtually or by phone or through the mail. We are also in the process of evaluating temporarily suspending cash payments through around Labor Day. That is, again, something that we think there would be some value to particularly minimize the number of transactions between staff and members of the public. And we'll be bringing a proposal to the Board of Selectmen regarding that next week. We are still obviously requiring our employees when they are in the building to wear face coverings when they are entering and exiting the building and when they're in common areas and such. We've been very fortunate. We've had over 900 donated face coverings from members of the public. Our social services department has been taking the lead on that. So we've been distributing those face coverings to employees and local businesses and others at no cost. And we've also been evaluating and preparing for building modifications that are needed, such as any screens, protective shields, partitions, things of that nature. So our meetings of public agencies will remain closed to the public now until further notice. Gatherings of 5 or fewer people has been extended until June 20th. So again, our meetings can't exceed 5 people through at least June 20th. At this point, we continue to use video Zoom, and we are airing our meetings live on SCTV. And for our regulatory bodies that are continuing to meet, they're doing so when they have urgent or pressing business that needs action. So very few advisory committees are meeting at this point. Again, we do have some that have met if there's urgent business that needs to be addressed. You may recall from our past updates that we were not able to hold our annual budget referendum due to the pandemic. So the Board of Finance did adopt a budget at their meeting just on Tuesday evening, and that the fire district had also adopted its budget. So the town mill rate for fiscal 2021 was set at 37.09 mils, the fire district mill rate at 1.19 mils, for a total mill rate of 38.28 mils. This does reflect a mill rate decrease for our taxpayers and would be about a $50 savings for the median valued home. Our property tax deferral program is now open. We are now accepting applications. Those are available on the Collector of Revenue's website. And at this point in time, we have 25 approved applications for the property tax deferral program, resulting in about just under $170,000 in deferred revenue at this time. And a reminder for those folks who would like to help other community members in need right now that our social services department is accepting donations. And again, I know Kristen will touch on this during her report, but we're happy to receive financial donations to help support our food programs, to help support emergency needs of our residents. We're also accepting toiletries, diapers, wipes, baby food, kid-friendly snacks, laundry detergent, non-perishable food items. So we've been so fortunate that our community has been so generous. And again, our social services department is helping to coordinate that effort. Thank you.
Thanks, Maria. And just a quick note on the budget for this group, as you recall, the deputy chief position and the additional lieutenant position were recommended out of the police commission and forwarded from the Board of Selectmen and approved by the Board of Finance for funding. So you will see additional staffing in the police department as a result of that update. So pleased that we are able to get that through based on the chief and the police commission's recommendation. I know that was many years in the works. So we should see that come through, and the recruiting process should be starting shortly from what I understand. So. Alrighty, Kevin and Michael, emergency management.
All right, well, I'll start off this morning. We've actually kind of stabilized on the emergency management side as we monitor the situation with the state opening back up and hoping that Jennifer doesn't get more busy on her end with a surge of the virus back up again. With Web EOC, the communication system with the state, because of the coronavirus, the Web EOC has been given much more money to play with, and they are boosting the system and making a more robust system for communication with the state, which is good. It is something that has been needed for several years, and I'll be going back for more training on that. And basically, you're boundless on what we can do with this thing, and the people behind it are being very, very smart and doing a great job with it. WSIM continues to pump out information for the residents, and we continue to ask that residents pay attention to WSIM for the latest information. We have more ads going on there, more spots going on there. And also we are starting to change into seasons. As we knew a couple weeks ago, we had our first round of thunderstorms come through. Make sure that people are prepared and you have your kits and your things ready to go in case of severe weather comes in. We also had our first tropical storm develop off the coast. So that season is starting to ramp up also. On the pod side, with giving out the personal protective equipment, the state keeps telling us that they are getting in more equipment and different types of equipment. We are putting in specific requests for things, and we continue to get some lower quality ones and some Chinese knockoffs, which we're not really happy about. We are trying to be more specific on our requests, on what we're asking for and what we're getting in. So we're continuing to try to get PPE, and then Jennifer mentioned about that. Also, the PPE distribution is getting larger and larger. We are going not only from one full Wednesday and one half Tuesday, we're going to a full day Tuesday. So much more equipment is coming in. We're just hoping it's going to be the right equipment that everybody needs to make sure we get it out to the people that need it. And with that, I will turn it over to Kevin.
Thanks, Michael. Excellent report as usual. We did have a pickup for the businesses this week. We're distributed over 875 masks again this week. In addition to that, there were 54 infrared thermometers for all the businesses to provide for temperature monitoring when they come walking in the door. So those are out right now. And thanks to Sarah from Main Street for distributing them for us. That's quite the job of over 30 or 40 participants in that project. So the businesses are trying to take care of themselves. Along with that, the openings of the businesses are one of the keystones of our objective list, and they are starting to open. We've been doing inspections on the fire safety side, as well as assistance through the emergency management side of the house. Certainly, as we said in the past, we don't want them to protect themselves from the virus, but yet be unsafe in their practices normally. So we're helping through education and help them try to get open. So that's about it on our end. We still continue to go on, and you heard a little bit about the possibility of testing that we're looking into on a localized area to try to get that ramped up. So any questions, we'll be more than happy to answer.
Thank you, Kevin and Michael. Appreciate that. We'll move right on to the chief, Chief Boulter, Police Department.
Yes, hi, good morning. Sorry, I hope the connection is okay and I'm not able to join you by video this morning. I'm going to try to pull over here. I'm just checking out some locations throughout town that have been of interest to us lately. So COVID-19 related, personnel-wise, staff-wise, we're doing very well, thankfully. Everybody is very healthy. We're still running at 20% of our workforce is working remotely still, and those are a lot of the administrative scheduled people, records, detectives, training, accreditation. They're still coming in when they need to, some much more often than others, some 1, possibly 2 days a week. And a few have been able to remain outside remotely or respond to scenes for investigations. And so working with Maria and following the guidelines as far as transitioning people back in, but everybody is doing well. The calls for service continue to increase, not necessarily the numbers, but the types of calls are changing now. So we're seeing an increase in the noise complaints. We're obviously preparing for the potential complaints about the violations or compliance to the reopening. So we'll be working with a bunch of different agencies on that. There's been a lot more traffic out, so we're seeing a definite increase in that, and that's been steady over the last couple of weeks, but we expect with the reopening that we'll see much more traffic. We know that the parks and our open spaces have been very busy. For instance, and we've had to do some coordination with some of them. For instance, Tanager Hill on East Weetog, they had closed their section of parking because the ground was so wet and people were calling and wondering why it was closed, and they needed places to go, and then they were parking on East Weetog Street. So we worked with the land trust. They marked it very well, and then we marked the street no parking. It has since opened up, and I'm glad that it has because the Memorial Day weekend coming up. But we're seeing, cars parking in places where they don't normally park. So people are looking for places to go. Sort of outside the COVID-19, the bears are definitely out and about. We have people, using, like I said, using our trails, our greenways. We did a posting yesterday on Facebook that we had an indecent exposure that we're investigating on a southern part of our greenway trail down behind Aspen Green and right near the between the Avon Town Line and Chubb Insurance, that connector there by Bidwell's. So with the increased activity of people out and about, we're gonna see some increase in some quality of life issues, some criminal activity, some traffic issues, and we are prepping for that. But otherwise, we are doing okay.
Appreciate that, Chief. And bear mace would probably take care of both of those situations. It's unfortunate that kind of crap is happening. All right.
Yes, very unfortunate. Oh, well, I'm sorry. One other thing, if you don't mind, Sean.
Yeah, of course.
With the passing of the budget, we'll be prepping for the public safety radio system for that to be moving forward. So we'll be moving forward as rapidly as we can with that to get that up and running as soon as possible.
Appreciate that, Chief. That's a great reminder. And again, thank you to Melissa and Lieutenant Sifo on once again saving the town over $1 million and still having that project move forward.
Yes, they did a great job.
They really did. Commissioner Long, anything to add from the police side? You good, sir? Okay. It is nice to see you this morning. All right. Any other questions for the chief? All right. Karen, ambulance.
Oh, good morning, everybody. I can report again, as usual. Everybody's been healthy and safe with our crews. Everybody's been doing well, and we are staffed up as our normal baseline to cover the town's needs. We did get a large distribution from the state yesterday. Thank you to Chief Baldus, who was able to pick that up for us. I certainly owed him a debt of gratitude for doing that for me. Unfortunately, my attempt to pick it up was not as I planned. There are quite a bit of items that we received that are probably not appropriate for us, but probably are, more appropriate for the general public. So Sarah and Kevin, if we can talk about this later, that we can get this distributed maybe to town members that could use it, that we actually are not going to be able to use. We can discuss that later if you'd like. But we did get some gowns and some N95s, and Chief Boulter, I'll discuss that with you as well later, what the police department can get from the portion that we received. But we do have quite a bit of stock on hand, but unfortunately, as Mike said earlier, it's not really what we need. A lot of face shields that we don't really use, some Tyvek suits, which aren't really our first line pieces of equipment to use. Excuse me. Allergies are getting me today. But we do have a lot of stuff, and I want to make sure we don't just keep a stockpile, that if we can pass it out to town, to the residents of Simsbury, they can use it, that we can't actually use it this time. So we can talk about that later. But otherwise, we're holding our own. Call volume is still down. We have been receiving some more emergency calls, which were warranted for going to the hospital. So I'm happy to see that. So again, my reminder to the general public is do not hesitate to call 911. Again, for chest pain, shortness of breath, any other issues, we're here to help the residents, and you should not delay, because as you can see on the news, there have been many reports about how people are delaying calling for help, and unfortunately, it's not necessarily a good outcome. So please call us. We're here for you, and that's really what I have again. So any questions for anybody?
Thank you. Appreciate that thoughtful reminder that is exactly what a lot of these folks on this call and your staffs are here for, so appreciate that. Chief Baldus, Fire.
Hi, good morning, everybody. We continue, as well as the other agencies reported, to be virus-free within our community of volunteers and their families, which is always a good report to be able to provide each week. We are planning to do a little bit more hands-on training. Up to this point, everything has been done on a virtual basis with our membership. But as of the 1st of June, we're actually going to start doing some training at the station level. So it'll still be in small groups. But obviously, with the work that we have to do, keeping the hands-on skills is critical to our ability to perform in an appropriate manner. So we are, in fact, going to start that training again on the 1st of June, which is Monday. which is our normal training night. So you'll see that start to happening. Our call volume continues to be fairly low, which is good, but our response to any emergency calls that we do get has been great. Obviously, with a lot of people being home, we've had no issues with staffing and ability to get the response appropriately. So again, thanks for the moment of silence for Lucy a little earlier. Certainly a person that we're going to miss greatly. And while she may not be here with us on Earth, she's certainly here with us in spirit, as I'm sure her work will continue to allow us to move forward with. Hang on, just have to not answer her phone. And as her work certainly made a big impact on what we do here in the Public Safety Committee, as well as other community events throughout town. So with that, that's all I have for today.
Chief, thank you for that. Appreciate it. Any questions for Chief Baldus? All right, Neil Sullivan, Board of Education.
Yeah, good morning, everyone. As the stay-at-home order has been lifted, we are going to be opening our buildings for access for staff. Our custodians will be coming off their staggered schedule and be back to a full crew starting next Tuesday, May 26th. And that's also the day that we will start to allow teachers to come in to sort of close up their rooms for the year the way they normally would, of course, practicing social distancing and just really doing some solo work in their rooms that needs to happen. So that'll start next week. In terms of other workforce decisions, most of our office staff has reported the ability to work effectively from home, and that will continue. We're like Maria said, for the town, we're sort of targeting June 20th as the next time to look at it and potentially go to a staggered schedule at that point for office workers. We were supposed to receive guidance about summer school at the end of last week. It didn't arrive until late yesterday afternoon, so we're processing that right now. The focus will be on what we call ESY. It's extended school year teaching for special education students and remediation efforts, especially for high school students needing credits. Probably the rest of our summer programming, that is enrichment programming, given the restrictions of the guidance, is going to have to go by the wayside for this summer. But I will say that the camp side with Parks and Rec is up and running, and we've had a good partnership with Tom Tyberski from Parks and Rec to get Camp Stuff to Do up and running at Central School. They're going to run it out of Memorial Park, and Central School will only serve as the emergency shelter for that camp in the event of a pop-up thunderstorm over the course of the summer. So that'll be some programming that will be offered. And lastly, our reopening Simsbury Schools Task Force will meet for the second time next week. We're starting to get information from various, other countries really, and some guidance from agencies about opening school. It's fairly overwhelming at this point, but we're trying to process that, and we have a great team in place to try to think about all the procedures that will need to be in place to reopen. And then lastly for today, I hope by next week to be able to give the details of Simsbury High School graduation plans. Obviously, they're going to have to look a little different. Steve Petrina and his team are working very hard to come up with a meaningful ceremony for our class of 2020. Can't give you all the details right now, but I'm hoping to be able to do that by next Thursday.
Thank you, Neil. Appreciate it. And if you could share with us parents how you guys are going to keep 5-year-olds in a mask 6 feet away from each other, I would very much appreciate that advice. Because
yeah, I'd appreciate some advice on that too, Sean.
It's I'm not going to say it's impossible, but you guys got your work cut out for you. It's my wife she's a school teacher in Hartford, so she got the word of the guidance is coming down. So it should be you guys have your hands full as always. All right, Mark, Kritz, anything from your side to add?
Yeah, Sean, just that the grab and go is continuing forward.
Okay.
Still getting about the average number of people coming in to pick up lunches and breakfast. So that's gone well. And there won't be any pickup for Monday because of the holiday, but we'll continue back on Wednesday.
Okay. Appreciate that. And that's obviously an important service for those in need. And Neil and Mark, you may get some questions through Matt on that because there was some discussion on the budgetary side, not concern, but discussion around food services, et cetera. So that might be coming to you through.
Okay, thank you.
Yep. All right. Public Works, Mr. Roy.
Oh, good morning. I think kind of just echoing what we've heard throughout this call. Starting on Tuesday, our crews are going to be off of their split schedule, and we're going to be back to full staffing during normal hours. We've put in some engineering controls and some different procedures to make sure with a larger crew that everybody's going to stay appropriately separate. Masks are going to be worn. Everybody has personal hand sanitizer with them, and we've been disinfecting the vehicles daily. We're going to be working with our buildings and ground staff to start to prepare the town buildings for reopening in this new world of COVID-19. As Maria said, we're looking at plexiglass screens and separators, looking at different modifications in some cases to some of the work areas and some of the fixtures, just to make sure that we're going to be ready to reopen to the public soon. And then we've been working with Simsbury Main Street in purchasing some hand sanitizer in bulk in gallon jugs that can then be distributed to some of the businesses in town. So we've been busy, but doing well.
Appreciate that, Tom. Thank you. Any questions for Mr. Roy? All right. Social Services, Kristen Formanek.
Good morning.
Hey, good morning.
As Maria shared, we continue to be the coordinators of donations. We still have our cart out in front of Eno, and we're collecting all non-perishable food items, as well as toiletries and household items. We're also happy to accept any items for babies and baby care. And we're also now accepting donations for pet food and pet care. We are continuing with our curbside distributions. We are now going to have a set schedule of an every 3-week schedule for our distributions. We're thinking that this will likely continue through the summer as we can't have the large congregation in the building for a formal cheese day operation. This is going really well. Our participation has been up. Typically, monthly, we see about 80 households for our cheese day, and we've been seeing close to 115 at our curbside distribution. So we know that the need has increased. We're also continuing with the coordination of the hand-sewn masks, as Maria had mentioned. We're over 900 for donated masks, and we're really grateful for that. We're getting them back out into the community every day. We're going to be working with the PD to do some pop-up roadside distribution out front of Eno. So that's going really well. And our staff is still healthy. We're available. We're also taking phone calls and emails every day from our clients and helping them as we can. Our seniors, sadly, we probably will not be able to open the senior center until the fall to protect their safety and health. But we are looking into providing some more programming with Zoom and getting just information out to our seniors electronically. And other than that, things are kind of status quo for us. We're participating in the planning for moving back into the buildings and what that will look like and what we'll need. And we will also participate in the long-term recovery committee. And I think that's it for me. And if anybody has any questions, I can certainly answer for you. Thank you.
Kristen, thank you for that. I appreciate your update. All right, Nancy.
Good morning. Luckily, I think I could continue to say our staff are healthy. We've had no issues in terms of contact spread. We do continue to take care of patients that are COVID positive. We have enough PPE, thanks to the health district and others. So it's good. We're doing okay. We got our infrared thermo scanner, so I want to say thank you to Sarah Nielsen and the governor and the state and whoever all was in part of that distribution. So far, I don't have a fever, so I'm still stuck at work. I was hoping, but here's the thing I do want to point out, and I do want to reach out to probably you, Kristen, mostly. We are aware of the fact that senior centers are probably going to be the last on the list to consider opening. Other towns that we have community health nurses have reached out to us because they've had some patrons and or some concern about people who normally show up at blood pressure clinics and whatnot. And they've asked if we would be willing to go and make other arrangements to see these people. We have no problem going to homes. We have plenty of equipment. And in the event that you have any concern, or EMS or anybody does, with regards to certain people and how they're doing medically, if you want us to do a wellness check, or even just set up for certain people, because there are people that come to these clinics religiously and they bring all kinds of medical questions. We'd be happy to set up the ability to go to their houses. And I think we could reassure them with a phone call that it would be safe to do. So we'd be happy to do some of that monitoring, because clearly we're not going to be opening up blood pressure clinics anytime soon. And we're going to have a struggle figuring out how to just do all the public vaccination clinics as it is. So if there's any need for any of that, please let us know.
Thank you, Nancy. This is Kristen. If it's okay with you, we could work later on an email blast that we could send out to all of our senior center participants that would let them know that you're offering that and how to make contact with you.
That would be great. That would really be good, because, it's funny. Some people know how to reach out to us, but most people at these sort of public senior center clinics, they're reaching out to the town people that they know. And then they called us in Canton and in Avon. So we started setting it up. We don't have phone numbers for people where we, can run through our contact list to call people, but I would be happy to work with you on that. That would be great.
Sounds good. We'll reach out to you later.
All right.
Thank you.
Thank you both for that. All right. Any questions for Nancy? Appreciate it, Nancy. Sarah, Main Street.
Good morning. So as many of you know, yesterday did mark the outdoor dining. It got underway. Again, a special thank you to the town of Simsbury, especially Mike Glidden, Kevin Kowalski, Henry Miga, and I know Jennifer Kutanis has left the call, but to the Farmington Valley Health District. They have been invaluable, even with all of the things that they have going on. Jason Brown, who's our representative for Simsbury, was still able to go out and do 4 opening inspections, because we had 4 restaurants that had previously been closed for several weeks, many weeks, reopen, and was able to do that very quickly and efficiently. And so I think that our team worked really hard to do some troubleshooting. I saw Mike Glidden yesterday. I know Kevin Kowalski and Mike caught up, but they were on the grounds, ironing out issues, and that's just a huge resource for the restaurants. The restaurants were just so appreciative of the streamlined process that the town of Simsbury had enacted. That went well. There were people doing outdoor dining. It started slowly, but we do anticipate that the volume will pick up over the weekend. Again, just a reminder, Main Street has the list of all the restaurants that are open, closed, and modified on the shopsimsbury.com website and on Facebook. But as the Farmington Valley Health District reminds people, if you are uncomfortable, if you have a underlying condition, and if you're over the age of 65, they do tell you, please exercise caution during this first reopening phase. Okay. So remember that all of our restaurants that are open still do takeout, curbside pickup, and or delivery. Okay. So just remember that, especially if you get nervous seeing people dining outside and you don't want to do that, that the other options that are safe are still available. As Kevin mentioned and Nancy, we have been distributing the PPE, the disposable masks from the state of Connecticut, as well as the new thermoscans from the state of Connecticut to our local businesses. And I anticipate that next week's delivery will be even larger, Kevin, than this week was, because somebody had posted a photo on Facebook, and everyone that didn't know this was happening contacted me last night. It was about 3 hours worth of messages. So I do anticipate that this week will probably be even bigger. So thanks to the fire district once again for picking it up, and Main Street is more than happy to deliver them. It gives me a good opportunity to also talk to a lot of our business owners in person. I was able to answer questions. We're still getting unemployment questions, things like that, and do a check-in. We had prepared the businesses, the non-essential retail, to reopen with the safety protocols. That is going very well as well. And we had delayed the salons. As you guys may know, the governor pushed the salon delay, the salon opening, salons, barbershops, and tanning from what was supposed to be yesterday until they're saying now June 1st tentatively. So we had gotten a lot of the salons ready. They had the proper barricades and PPE and whatever was necessary. So there's a little bit of disappointment, but they're looking forward to, again, getting ready to reopen when they're able to. I again want to thank both Maria Capriola and rockstar Tom Roy for the hand sanitizer. Right now, hand sanitizer is like gold. And so finding it in bulk for our businesses to purchase, that's not $100 a gallon, has been no small feat. And so again, showing what an amazing public-private partnership between the business community and the town. We already have 4 cases ordered, and we have more orders coming in. And then I just wanted to let people know that Dino Nobel is going to be donating a couple of gallons of hand sanitizer to Main Street. I'm going to give a couple gallons to Tom Roy, to Public Works. And I don't know if Nancy needs any, or the ambulance, but I have 2 or 3 more gallons that we can donate, to be used by the town. So thanks to Dino Nobel, and thanks to all the business community that continues to be fantastic partners, even with sales declining, even in this new way of doing business. They continue to give back to the community. And I just think that, again, a reminder, please support Simsbury businesses. It's going to be incredibly important. There's so many great businesses everywhere, but putting your money in Simsbury businesses, especially during this time, is going to be more important than ever. And then a final reminder that we are continually updating the list. We updated it again, in advance of the May 20th, new updates. I've seen, others, the Simsbury Patch and others have tried to do this. We have a list of more than 150 businesses Main Street has. Everybody else has 2-3 dozen, and a lot of them are not Simsbury businesses. This is more than 150 businesses. They're all in Simsbury, and it tells you how they're open, closed, modified, their contact information. So please share it on, pass it on, and let's just promote our Simsbury community. That's it.
I agree. And if I could just add on to that, having gone to some of my favorite restaurants, meeting with the owners and staff that are working there, obviously they're working hard. You can see that folks are scared about their businesses and about their employees, and they're doing the best they can. So it really does make a difference when we show up and buy a pizza or get some takeout or whatever else. And it might not seem like a big deal, but it is meaningful to these folks. And I know they're appreciative of all the support that you and the other residents are giving. So thank you, Sarah.
And remember, they pay taxes. That's important.
And they're also our neighbors too. A lot of them live in town. A lot of them live down the road and we might not know it. They got to pay their mortgages. They gotta buy food too. So it's important. These are the little things we can do to help each other out.
Agreed.
So, all right. Mark Massaro, as patient as always. How you doing, sir?
Great. Thanks, Sean. At the end of last week, we emailed our customers about just reminding them about scams, and we're not doing any disconnects for non-payment. We're not doing a lot of those things that scammers try to scare people with and get them to pay over the phone or go get cash cards and so forth. So we issued an email. There's a bunch of information on eversource.com, our website. So we strongly encourage customers, both residential and business customers, to contact us if they're worried about a phone call that they might get or someone knocking at their door. We are not going door to door. We're not sending anyone door to door, doing any door tags, anything like that during COVID. So if you see any of that, please give us a call if you're worried, or even reach out to the police department. But we're available. Our customer service reps are available, and there's quite a bit of information on our website about latest scams. So just encourage everybody to do so. And then just a quick reminder, if there's anybody that really needs help with payment arrangements for their bills, we strongly encourage our customers to reach out to us to do so. Thank you.
Appreciate that, Mark. Appreciate the thoughtfulness of your company during this time. All right, folks. Other updates, questions, concerns for the good of the order this morning? All right, we kept it to under an hour. I appreciate that. Thoughtful, robust updates, good stuff. We're going to keep, Maria, keep me straight here. We're going to keep this weekly for the next one, and then we're going to move to every other week.
Close. I think we settled on, that's okay, it was very close. I think we settled on that we would skip next week.
Okay.
Go to June 4th.
Yep.
And then from June 4th, we had actually 2 weeks out a regularly scheduled Public Safety Committee meeting, but that we were going to change to 8 just because we've been regularly meeting at 8 now. So we should have a June 4th and a June 18th at 8 a.m. And we will make sure we send out those updated invites this morning with the Zoom info.
Okay. All right. Yeah. And again, this meeting has been, I think, a phenomenal resource to the residents. I know it has been for me. But again, in respect to your time, I think it's okay to move to every 2 weeks. Obviously, if things ramp up, we can always meet again. And if things continue to smooth out, which we all hope they do, perhaps we can go to a regular cadence sooner rather than later. But again, appreciate you all sticking with. I know it's extra time in all your calendars and all your days, especially listening to my sermons. But I do appreciate that you're willing and able to give the residents a regular update, because it really is meaningful for them. Folks do appreciate this. They do take a lot of comfort in the professionalism and thoughtfulness that you all execute. So thank you for that. And with that, we are adjourned.
One final thing, Sean.
Sorry.
Just a quick reminder, because I'm hoping to save all of us a little bit of time, especially the health district. If the residents that are watching are concerned and they think that there's an egregious violation, as Jennifer mentioned, then absolutely contact the proper authorities. Having said that, it's going to be Memorial Day weekend. You can tell the police are working on, issues. I mean, everything is starting to really ramp up. The health district is working on issues. Mm-hmm. Please exercise some patience. Please hesitate before posting or calling about masks and things, because our staff are incredibly busy on very important things. And not to say that the public's concerns are not, but just make sure that you weigh, is it important enough? And then absolutely make the phone call. But understand that, calling for every single thing you're seeing, it just, during this time frame, it just takes too many staff resources. Please be careful.
It's a good reminder, Sarah. Thank you. All right, folks. Now we are adjourned. Have a great day, everyone.